Hi, everyone. I'm Maggie McGrath, Senior Editor at Forbes. Cases of mosquito-borne illnesses are on the rise in the United States. And here to explain exactly what we need to know about the situation is my colleague, a senior editor covering healthcare and science, Alex Knapp. Alex, thank you so much for being here.
Thanks for having me.
All right, so let's start with the basic who, what, where, when, why, and how. What are we seeing in terms of mosquito-borne illnesses in the United States right now?
Sure. Probably the biggest mosquito-borne disease we're seeing right now is West Nile virus. You may have seen that a few days ago, Dr. Anthony Fauci was diagnosed and hospitalized for 6 days with West Nile disease. He's out of the hospital now and recovering. There have been nearly 300 cases reported so far this year, and we're actually getting into the thick of mosquito season, so we can expect to probably see a few hundred more before the year is out. Last year we saw nearly 2,500 with over 1,800 hospitalizations and 182 deaths. So it can be a very serious disease, and we are starting to see that uptick happen.
300 cases so far. We're expecting to see more. Let's dive into what we will expect to see. What are the symptoms of West Nile virus or disease, and how should someone know if they should seek treatment?
Sure. Interestingly enough, about 80% of people aren't going to see any symptoms at all, which is part of what makes it kind of travel easier because if you get bit and you have no symptoms, that mosquito might go on to somebody else who does get symptoms. And so just not knowing that you're infected is part of the reason why it spreads so much more quickly than some of the others. If you do have it, you might see things like fatigue, really bad headache, nausea. And so if you're feeling, some of these awful symptoms and you've recently know that you've been out or have been bitten by some bugs, it's probably good to go get checked out as soon as you're able.
What is the treatment for, and again, I know there are a number of mosquito-borne diseases, but let's keep it on West Nile. What is the treatment?
Right now, there's no specific treatment for West Nile, nor is there a vaccine. So the care they give you is basically palliative. If you're throwing up, they'll make sure that you're hydrated. If you have other symptoms, they'll do what they can to reduce the fever and everything else. But one of the things that does make it dangerous in these severe cases is the fact that we don't have a specific treatment for West Nile yet.
Yet. How much work is that word "yet" doing? I mean, I feel like we've heard about West Nile virus for years. So the fact that there's not a good treatment or a vaccine, where is the science right now?
Sure, there are some drugs in development right now, but it's several years away probably before we're going to see any FDA approvals or anything like that. We may see a speed up. There's been an increased interest, and we've had some really recent wins against other mosquito-borne diseases, like new vaccines for malaria, new vaccines for dengue, and so hopefully West Nile will follow in those footsteps.
What states are experiencing the highest incident rate? Is it equal across the U.S., or what do we need to know for how on alert we should be?
Gotcha. Well, basically, the safest place to be is the Pacific Northwest, where there's really not that many cases at all. If you've been to the PNW, you know that you don't really get a lot of mosquitoes out there. We're seeing the highest incidences in Texas, as well as the Northeast in New York, Pennsylvania, New Jersey, Virginia, also Wisconsin, Michigan, and Illinois has seen quite a few cases as well.
And those, of course, are states that are prone to this warmer, more humid climate. Alex, how much of this incident rate can we attribute to climate change? We're seeing more extreme hurricane seasons. We're seeing more extreme weather over the course of the summer, really across the globe. But is there a tie to climate change in all of this?
There is a tie to climate change. One thing that we're seeing, especially in the north and in the northeast, is that the mosquito seasons are getting longer by about 14 to 15 days, depending on the exact region. And that having more mosquitoes out and around and just having those 2 extra weeks is just 2 more weeks where the diseases can spread. And we're also seeing mosquitoes being able to thrive in some places where they couldn't before, simply because the weather has gotten warmer. So there are regions seeing mosquitoes and seeing mosquito-borne diseases that didn't previously because it was cool and mosquitoes didn't necessarily thrive in those spots.
That's really concerning. And this is a selfish question, but as someone who keeps her windows open rather than turn on the AC all the time, I woke up this morning with a bug bite on my arm from a fly that got in overnight. I'm assuming it's a fly, but for folks who live in the states that you just outlined, should we be keeping our windows closed? I mean, obviously stay away from swampy areas if you can, but what's the advice for prevention here?
Yeah, the main ideas for prevention is, even with the heat, you probably want to, especially if you're at high risk, if you're either children or elderly, you're going to want to wear protective clothing. So longer sleeves, longer pants, loose fitting so you stay cool, but you are going to want to wear those longer clothes, especially if you're going to be outside in a wooded area or a place that's going to be prone to mosquitoes. And, wearing off and other kinds of or similar bug sprays is good. Keep those citronella candles on your back porch if you're going to be hanging out. Just the usual keep mosquito away preventatives.
It's harder in a city. I don't typically walk around New York with a citronella in my pocket, but you know what? Maybe now with these cases on the rise, I will. And you said that the season for mosquito-borne diseases is getting longer. So how much longer into the late summer and early fall will we be on alert?
So yeah, like I said, it depends on the region. Anywhere from a week to 2 weeks, though. So you're going to be seeing the bugs out longer, and that's just kind of the reality of it.
And the other disease that's making headlines is something that is being called EEE. It has a longer name. What does that acronym stand for, and what do we need to know about it?
Sure. This is Eastern equine encephalitis, which is a mouthful, which is why we usually say EEE. And it's a much rarer disease than West Nile. So there have only been, according to the CDC, 4 cases reported so far. But it is a much more serious disease. You're much more likely to be hospitalized. In fact, in just the 4 cases we know about, there are 3 hospitalizations and 1 death already. And if you get the severe version of the disease, the death rate is actually close to 30%. It's a really severe disease, although thankfully much rarer than other mosquito-borne illnesses.
What do we normally see as it relates to EEE? Is the fact that there have been these 4 severe cases abnormal?
It's not particularly abnormal. We do see a few cases every year, according to the CDC, not only locally obtained, but also in travel and also in the territories, so Puerto Rico and the Virgin Islands, although it still remains, pretty rare even in those places. But we can probably expect to see more cases simply because, again, mosquito season's getting longer. More people are traveling, and especially, people like to travel in the fall, and they travel to warm places where there's lots of mosquitoes, and so you have those dangers as well.
So you mentioned Puerto Rico, U.S. Virgin Islands. What about stateside? I feel like we've seen some of those EE cases in the Northeast.
Yes, right now it's pretty much confined to the Northeast. So the 4 cases we've seen are in Vermont, Massachusetts. Not Vermont, New Hampshire, Massachusetts, New Jersey, and Wisconsin.
Oh, wow. So 1 in each. That's, yeah. I have to say, I mean, what I've read about EEE and just the word encephalitis, it's scary. So what should regular people who don't live near wooded areas or swampy areas be on alert for EEE, or what's your take? My
take here would just be to listen to your local public health officials about what the danger is in your community. So in the Northeast, there have been some park closures because of concerns of spreading EEE. And there's other warnings to people in particular age groups, like West Nile. If you're elderly or young, you're more prone to get a severe reaction if you're infected. So I would listen to your local health officials and follow that advice.
Here in New York, there are headlines about how the city is going to be doing yet another spraying of the city against mosquitoes. How much of that are we seeing in the affected states, and how much more should local governments be doing right now?
Well, it's a good question. I mean, you're definitely going to see more of this, especially I think in parks where people like to congregate and things like that. But it's a challenge to control mosquito populations. They do regular sprayings in Africa and in other parts of the world as well to combat malaria, but it still infects large numbers of people every year. So really, your best bet is, again, wear protective clothing, wear things to keep you off. And if you're at a high risk for a disease and your local health officials are worried about it being in the area, it might be time to visit less wooded areas and explore other parts of the region that maybe you haven't before.
And of course, we've been talking about mosquito-borne diseases. It is a mosquito bite that instigates the illness. Is it possible, though, if I've been bitten, and knock on wood, and I get sick, hopefully I don't, can I pass it on to a sibling or a family member if we're in the same living quarters? Or can these diseases go human to human?
It's very rare for them to do so, and there's very few recorded cases. Mostly the risk is, and it goes kind of human to human via mosquito, basically. You're infected and maybe you don't have symptoms. A mosquito bites you, and then it moves to your sister and bites her, and she gets a severe reaction. That would be the more common way for it to spread from human to human.
And then no vaccine for West Nile. Is the same true for EEE?
Same is true for EEE as well. So there's no specific treatment, no specific vaccine. So just be careful and follow the advice of your local public health officials.
Is there anything else we need to know about mosquito season and mosquito-borne diseases, Alex?
I would say the best thing is for these next few weeks just to stay safe. But fall and cooler temperatures are around the corner, and we can start to worry about respiratory diseases like the flu, RSV, and COVID instead.
Oh, well, that's optimistic. I was about to say, I'm really looking forward to the fall, but I think I might need my flu shot before I can be fully excited.
Definitely recommend you get your flu shot. There are updated COVID shots as well that I strongly recommend. And for people over the age of 55 should also get RSV shots, as well as parents of newborns should also consider an RSV shot as well.
All right, Alex, you'll have to come back when we are in the thick of respiratory disease season. That's a mouthful. But in the meantime, thank you so much for breaking down what we need to know about mosquito-borne disease season.
Okay, great. Thank you, Maggie.